महाराष्ट्र के माननीय राज्यपाल CH विद्यासागर राव जी, प्रवरा इंस्टीट्यूट ऑफ मेडिकल साइंस के कुलपति श्री विजय केलकर जी, प्रवरा इंस्टीट्यूट ऑफ मेडिकल साइंस से प्रो कुलगुरु डॉक्टर राजेंद्र VK पाटिल, प्रो चांसलर, मानद पदवी प्राप्तकर्ता डॉक्टर अशोक पंगरिया जी, प्रवरा इंस्टीट्यूट ऑफ मेडिकल साइंस के उपकुलपति डॉक्टर YM जयराज जी, प्रवरा इंस्टीट्यूट ऑफ मेडिकल साइंस के रजिस्ट्रार डॉक्टर SR वरुण जी, सर्वांना नमस्कार. डॉक्टर बाळासाहेब VK पाटील यांनी स्थापना केलेल्या प्रवरा इंस्टीट्यूट ऑफ मेडिकल सायन्सचे 76वा अवस्थेत भाग घेण्याचा मला खूप आनंद झाला आहे. आज मी पदवी घेतलेल्या सर्व विद्यार्थ्यांना अभिनंदन करतो. पालकांना आणि शिक्षकांना माझी शुभेच्छा. माय डियर students, parents, elders of this area, faculty members, and also the dignitaries on the dais, I am extremely happy to be admitted you today to take part in this function for two reasons. This has been my wish for long, that medical institutions, universities should be located in rural areas. I am seeing it in reality today. Mahatma Gandhi, after independence, he gave two advices. One advice is political. I don't want to deal on that. His first advice was, he said, disband Congress. Congress was a platform of people fighting for freedom. आज़ादी के लिए सब लोग एक मंच पे आके ब्रिटिश वालों से लड़ रहे, उसका नाम दिया उस समय कांग्रेस. आज़ादी मिल गया, इसलिए इसको समाप्त करके अपना अपना पार्टी को आगे बढ़ाओ, ऐसा महात्मा जी ने कहा. तो वो तो अभी हमारे लिए वो महत्वपूर्ण नहीं है. दूसरा मुख्य सुझाव जो महात्मा गांधी जी ने दिया है, उन्होंने कहा, सबको कहा नेताओं को, गांव के ओर चलो, बैक टू विलेजेस. बट अनफॉर्चुनेटली आवर elders have not given enough importance to Mahatma Gandhi's advice, and they started moving towards cities. With the result, now we have two Indias. One is India, another is Bharat. We must see to it that these two things come together and we become a powerful nation. महात्मा गांधी जी ने कहा, ग्राम राज्य के बिना राम राज्य अधूरा है. He said, Rama Rajya is incomplete without Grama Raj. That is the import. See the foresight of that great man. Following the advice of Mahatma Gandhi, Sri Vittalbhai Patil and Sri Balasaheb VK Patil, they have taken the spirit of that advice and have established these institutions. And today they have grown in numbers, in quality, and we are having a multi-speciality hospital in a village. That's why I am very, very happy to be administered today in this function. Even the governor was telling me, he wanted to speak for some time. No problem, governor is governor. But he was saying, because we are here in a rural area and our people are doing a great job in the rural areas, that's why he wanted to say a few words. That speaks of the desire of all of us that we should have more focus on the rural areas. So before I proceed further, I would like to pay tribute to these great sons, Vittalbhai Patil and also Balasaheb VK Patil, for their foresight and for their contribution for the education and health of the people of not only Ahmednagar district, but also state of Maharashtra. Friends, the second reason of my happiness is that when I was giving gold medals, good number of them were girls. That is the need of the hour. As a Vice President of India, I have been going around number of universities. In the last 16 months, I might have gone at least to 75 universities. And everywhere I found that maximum number in some places 60%, 70%, 80% toppers, gold medalists, PhDs are girl students. That's a very, very happy trend, positive trend. Because population 50% are women. We have to take care of them. You cannot call yourself a developed country unless all sections are developed. Women also are taken care who are 50% of the population. So that's why this is a happy trend that's catching up, and it should go on, move on forward. And I'm sure that it will definitely move on, provided an opportunity is given. Some people say, sorry, हमारा पद्धति नहीं है सर, बच्चे बेटी पढ़ के करना क्या है बाद में, रहना है घर में. ये तो पुराना जमाना भाई, वो पुराना के पुराना था ना, उस समय भी ये नहीं था. महिलाओं को हमारा पुराणों में भी महिलाओं को प्राधान्यता देते थे. अब देखिए देवी देवता सरस्वती देवी शिक्षा मंत्री, पार्वती देवी रक्षा मंत्री, लक्ष्मी देवी वित्त मंत्री, फाइनेंस मिनिस्टर. That was the thinking, if you believe in Puranas. And even आप देश में जो नदियां है उसका नाम याद करिए. गोदावरी, गंगा, कावेरी, यमुना, सरस्वती, महानदी, महेंद्र तनया, नर्मदा, तपती, सभी नदियों का नाम महिलाओं का नाम रखा है. देश के बारे में कहते समय भी हम लोग कहते भारत माता को जय हो, भारत पिता को जय हो, ऐसा नहीं कहते हैं ना. माता, इतना महत्व दिया महिलाओं को. इसलिए आज का इस जमाना में हम लोग महिला का शिक्षा के बारे में ज्यादा प्राधान्यता देना चाहिए. प्रधानमंत्री ने दूरदृष्टि से ये बेटी बचाओ, बेटी पढ़ाओ, बेटी बढ़ाओ, ये नारा केवल नारा नहीं है, एक उद्यम होना चाहिए देश में. हम सब लोग उसमें भागीदारी होना चाहिए. There has to be a change of mindset among the men and women that we should give equal importance to the woman. I am delighted to be amongst you today. The 13th Convocation Address of Pravara Institute of Medical Sciences, deemed to be university, which is the brainchild of Padma Bhushan late Dr. Balasaheb E.K. Patil, a true son of the soil. I am happy to share with you. I also had an occasion to work along with him during the early days of Sri Atal Bihari Vajpayee government. We used to discuss, meet, and also exchange our ideas. I have had a 25-year-long association with Dr. Balasaheb E.K. Patil. He was a valued colleague in the parliament. He is a true Gandhian, following the Gandhian spirit. Although we were earlier belonging to different political parties, now of course I have no party. I am a non-party man. I have retired from politics, but not tired from public service. We always used to find converging areas of interest, especially in the field of rural development, a quest that is close to my heart. I am from a village. मैं एक किसान का बेटा हूँ. बचपन में 3 किलोमीटर पैदल से जाके बस पकड़ के शहर में जाके पढ़ के फिर वापस आते थे. हमारा गांव में बिजली भी नहीं था उस समय. मेरा परिवार में कोई पढ़े लिखे भी नहीं था. फिर वो बैकग्राउंड से आया हूँ. इसलिए मुझे ग्रामीण विकास के बारे में, गांव के बारे में, खेती के बारे में, किसान परिवार के बारे में मन में बहुत रुचि है. Agriculture is our basic culture. Every one of us, in fact, should give more and more importance and preference to agriculture. Sri Balasaheb E.K. Patil was much admired for his simple living and his commitment to undertaking developmental projects at the grassroots level. Dr. Balasaheb E.K. Patil is the proud son of late Dr. Vittalrao V.K. Patil, a legendary figure in the history of the cooperative enterprise in the country. He pioneered the use of cooperative movement as a tool for social, educational, economic upliftment of the rural masses. At the outset, I also would like to congratulate Dr. Ashok Pangaria, who has been recognized by this university for his service to the nation in the field of neurology and medical sciences by conferring the honorary doctorate upon him. I understand that PIMS-DU offers graduates, postgraduate, PG diploma and PhD programs under the Faculty of Medicine, Dentistry, Nursing and Allied Health Sciences. It is truly heartening to note that as many as 437 graduates are being presented with their degrees in this convocation here today. I would like to congratulate all of them. Not only congratulate students, but also their parents also. My heartiest congratulations to all of you. My sincere appreciation to the parents for supporting and trusting their children, thus empowering them to fully explore their talents and creativity. I am glad to note that the Institute is striving to provide quality education and training to the health professionals of the nation. On the other hand, through its multi-specialty tertiary hospital and its specialist doctors, nurses and technicians, the Institute is providing tertiary health care to the rural population. That's a very happy thing to note. I applaud the Institute for extending their health care and research to tribal areas also. As India aspires to have more qualified doctors, nurses and therapists serving in rural areas, the Institute is rendering valuable service by meeting the healthcare needs of the rural populace. I appreciate the Loni Pura model of this Institute through rural in location. It is truly urban in terms of facilities and amenities. This is what late President Dr. Abdul Kalam wanted. Pura, he gave an advice. It is indeed a unique model of excellence, and this has to be followed across the country. I congratulate the visionary leaders Dr. Vittalrao V.K. Patil, Padma Shri Awardee Dr. Balasaheb V.K. Patil, Padma Bhushan Awardee for their foresight and missionary zeal. My dear young friends, I strongly believe that it is the youth of a nation that will determine its future. As you are aware, India has a burgeoning youth population. United Nations Population Fund estimates that the window of demographic dividend opportunity in India is available for 5 decades, from 2005 to 2055, longer than any other country in the world. 65% of Indian population is below 35 years. The working age group 15 to 59 years accounts for 62.5% of Indian population. It's a great advantage, but it's also a great challenge because we are living in an aspirational India. This immense advantage can create the space needed to increase investments in enhancing human capabilities, which in turn can have a positive influence on growth and development in the time to come. Thrust on quality higher education, especially professional and technical education, is imperative to empower the youth so that they can play a meaningful role in nation building. I am extremely glad to know that this university is setting new benchmarks in excellence through its commitment to advancing meaningful teaching and learning, promoting need-based research, amplifying community engagement, and accelerating internationalization, all the while serving the poor and the needy. My dear youngsters, you should understand the challenges before us. We are living in an era of LPG, liberalization, privatization, globalization. The entire world has become a small village. You can know what is happening in Washington within few minutes, and people in Washington will be able to know what is happening in Pravara, in Loni, in few minutes. Technology is spreading. So there are opportunities, there are challenges also. We must understand the good practices of others, best practices, and we must also exchange our knowledge, our understanding with others. My dear sisters and brothers and youngsters, in any student's life, convocation is a crucial ceremony. It marks the completion of an important phase of life and symbolizes the beginning of the next significant phase. Attainment of a degree is only a milestone, not the end of itself. As Kelkarji was telling, this is only the beginning. So going by the challenges, you must continue to learn. not yearn. Everybody should continue to learn. And some of you may be thinking of going abroad. I don't think there is any need to go abroad now because everything is available in India. India also is making, and now India is become a medical tourism hub. I see wonderful things happening in Mumbai, in Hyderabad, in Bangalore, in Chennai. Patients from African countries, from Bangladesh, from other Asian countries, they're all coming to India. Earlier, any politician with any small heart problem used to go abroad. But people are coming here. Thanks to the knowledge, wisdom, and spread of education in India. My advice to some of you, if still you want to go abroad, go. 3-line advice, follow. Go, learn, yearn, and return. Return to serve your motherland, your native district, your native place. Take care of your parents, grandparents, your village. That is your basic duty. I am sure all of you will take up the mantle for serving the nation selflessly. Emphasis must be placed on continuous learning and updating of the existing knowledge base. The world of science and technology is undergoing rapid transformation, and I urge each one of you to be poised to absorb and utilize these innovations for the greater good. The Prime Minister said, 3-line advice. He said, reform, perform, and transform. Transform the nation, transformation. That is what is needed. Transformation of this kind. Pravara education happening in the rural areas. Doctors, PhDs coming from the rural areas, willing to serve the rural people. That is the transformation that is required. I am happy that this transformation is taking place here. Let me tell you that the future belongs to brilliant innovators and leaders whose priority is to serve the masses selflessly. Medical profession, political profession, education profession, they are a mission. Some of them, unfortunately, in these fields are trying to convert them into commission. Earlier it was a mission, some are trying to commit it to a commission. We should not do it and should not give any remission or do any omission. That should be our passion to go for this mission. That is my ambition and advice to all of you. Try to understand this. People treat doctor next to God. When they have such a confidence, we must take care of them. The career path you have chosen is rife with a number of challenges today. New problems are coming, new diseases are coming because of two things importantly. One is climate change overall, but at the same time lifestyle changes. I advise all the youngsters, please go back to your roots. Parents also to advise their children to follow the old system of life. You must not forget your culture, your heritage, what is given by your forefathers. Follow that lifestyle. Don't go for a sedentary lifestyle. Life is becoming mechanical. There is no physical activity at all. We must go back to physical activity. Do some physical fitness exercise. Become a fit personality. If body is fine, mind will be fine. If you are healthy, then you can become wealthy. A healthy nation can become a wealthy nation, but it cannot happen vice versa. A wealthy nation, there is no guarantee that you can become a healthy nation. If you may have so much money, if you are diabetic, you can't eat even a sweet. So lifestyle, there has to be some exercise. The government of India has proposed before the United Nations about yoga. I am very happy country after country is following yoga. Yoga is an exercise of body and mind. It has nothing to do with religion. Some people are trying to attach it to religion and say, sir, there is a problem. One boy told me, sir, I have no problem in yoga, but there is one problem. I said, what is your problem? He said, sir, yoga means Surya Namaskara. I said, what is your problem, sir? Surya Namaskara. I understood. I told him, if you have objection for Surya Namaskara, then do Chandra Namaskara and do the exercise. Yoga is for your body, not for Modi. You have to understand that. The Prime Minister might have taken lead, but it's a national program. It's an ancient culture of this country, art of this country. I have been to Costa Rica recently and some of the other Latin American countries also. Everywhere I found yoga training centers. And the Costa Rican president, whose age is only 39, He issued a presidential proclamation saying that the yoga is good for health and everybody should practice it. Presidential proclamation in Costa Rica. And here in our country, some of us are still hesitating. Second reason is lifestyle change. After that, food habits. We should also focus on our food habits. You may be wondering why the Vice President of India, the Constitution Authority, is talking about small things. Lifestyle and food. These are basic, they are very important, they are vital for spread of the non-communicable diseases. This is a study that has been made everywhere, says food in India is time-tested by our forefathers according to season. They have prescribed the food and we have such a wonderful food in India. Why do you worry about the packed food, junk food? I call it a junk food. Pizza, burger. People are developing weakness for instant food. Instant food means constant disease. This has to be understood by one and all. Children, they go to restaurant and then the branding, the traders also, they do branding, give names and also promote it through actors. And by others also, give different names. And they go to restaurant. The name is Chicken 65. Your age is not even 25 and you want to eat 65. Chicken Manchuria. You are in Himalaya and you want to eat Manchuria. Why Manchuria, Somalia, Bulgaria? And you have your own beautiful food, Marathi food, wonderful. Tamil, Telugu, Kannada, every state has got some speciality. Our food items are becoming universally acceptable everywhere. Your idli, sambar, dosa. Your food items have been going around. That is the case. Why should we follow that sedentary lifestyle and then follow the Western food habits? Please understand, life expectancy at birth has increased. Infant mortality and crude death rates have been greatly reduced. Diseases such as smallpox and polio have been eradicated and leprosy has been nearly eliminated. It is true we have achieved a number of significant milestones in the health sector, but yet lot more needs to be done to ensure health security to our vast population. India is undergoing a epidemiological transition today. The burden of the non-communicable lifestyle diseases is on the rise, dominating over communicable diseases in the total disease burden of the country. India also faces challenges of unequal access and rising cost in health care. There is also low health insurance penetration, leaving a large section of the people to incur out-of-pocket health expenditure, pushing many families to poverty. There is also a great rural-urban divide when it comes to health care. Urban areas have 4 times as many medical practitioners compared to rural areas, making rural India grossly underserved. The quality of medical education also varies between rural and urban centers. Our primary healthcare centers, which are the first point of contact for patients, are facing funding issues and also infrastructure lacunas. Doctors do not want to go to village. They want to be in city. That's why I've been suggesting the government that every government should make it a rule mandatory that every doctor, before getting his first promotion, must compulsorily serve in rural areas at least for 3 years. That should be made a rule. Then only the rural population will be taken care. Universal health coverage is the need of the hour. It can resolve a number of issues we face in the health sector by standardizing healthcare infrastructure and providing value-based medicine. Always remember that the healthcare sector represents a huge opportunity to leverage technology to improve critical processes that would aid the delivery of quality healthcare. With technology, it is possible to reach millions of people who are geographically spread across the country, providing better and more accurate diagnosis, managing treatment and facilitating effective collaboration and dialogue between doctors and healthcare workers. The cost of providing medical services has also been rising steadily. The integration of technological innovation with healthcare delivery will enable scale and lower healthcare delivery costs. I urge upon all the education institutions to invest a sizable portion of their budget in research and development for the discovery and advancement of new technologies. My dear young friends who are earning coveted degrees today, let me remind you that the profession you have chosen is a mission. You will play a critical role in nation building. I have said time and again that only a healthy nation is capable of being a wealthy nation. It is upon you to safeguard the health of this nation, enabling it for it to take its rightful place of leadership in the world. It is truly unfortunate that the quality of health care delivered in this country is very often determined by the price that is being paid. This is what being talked about. Today, I urge upon all the young doctors, budding healthcare professionals present here to treat all your patients, both rich and poor, with the same commitment, investment, respect, and integrity. In your able hands lies the power to transform their lives. Use your talents wisely and well. Serve the nation with passion and missionary zeal. Adopt the Kaizen or the principle of continuous improvement to excel in all walks of life. Further, nurture the values of nationalism, patriotism, honesty, peace, compassion, respect, harmony, and coexistence. I also suggest that please love the nature and live with the nature. Nature, culture, together for better future. Nature, culture, together, better future. That should be our aim. That should be our model. We are very fortunate. We have 365 days bright sun. We must take advantage of the same. And we also have huge water resources. We must take advantage of the same. Reduce, reuse. Reduce, reuse, recycle water. That should be our lifeline. And then also plant as many trees as possible. Greenery, that gives you more happiness. And also, India always believed in Vasudaika Kutumbakam. The entire world is one family. India was once upon a time known as Vishwaguru, but we never attacked any country. All Tam, Dick and Harry came and attacked us, ruled us, ruined us, rooted us and cheated us also. Yesterday I was in Goa. Portuguese came to Goa, captured it. We, being such a powerful nation, Vishwaguru once upon a time, it was acknowledged by Pahian, Huansong, Chinese historians. They wrote in the history. And we also have so much wisdom. We had 27% of our world GDP some time back in India, but India never attacked any country because we believe in Vasudaika Kutumbakam. Entire world is one family. Sarve Jana Sukhino Bhavantu. Share and care is the core of Indian philosophy. That should be part of your life. Share and care is the core of Indian philosophy. I urge upon all the youngsters to follow this philosophy, which was given by our elders. Let this ideal act as a beacon during the testing times. I am glad to know that Pravara Medical College Trust was established in 1976 as a 100-bed hospital to serve the poverty-stricken people of this drought and epidemic-prone region. It is indeed very heartening to know that today it has become 1,275-bedded hospital, offering super specialty service to the rural people of this district and neighboring districts at a very reasonable cost. This is the model to be followed. I am told that this trust has also been providing free medical facilities to all the children below 12 years of age and to senior citizens. I am also really impressed by the community engagement of this university, including adoption of more than 400 rural and tribal villages for the provision of health services. I congratulate the faculty, the students of this university for being true change agents. I am also delighted to know that this rural university has strong international engagement with over 31 active academic research and medical care collaborations with foreign universities, research and development organizations across the globe. I call upon my young friends to dedicate themselves to the service of mankind, mitigate hunger, poverty, ignorance, and blind beliefs. Today, you have made your university proud. It is time to go forth and make your nation proud. The word Pravara means excellence and eminence. It is a word used to describe distinction and achievement. I hope that all the students passing out of the portals of this institution will, through their noble deeds, keep this grand tradition of Pravara alive and blazing. I would once again congratulate all of you, all the students who are all getting graduated today, and also I advise you all focus on rural health care. I also hail from a village, as I told you. My heart is in villages, though I am living in cities, Delhi and Hyderabad. My heart, dil गांव में है अभी भी. कारण क्या है, वहाँ से आए हम लोग. So everyone has to take care of the rural people, spend some time for the rural health care. One. And secondly, that we should all aim high, work hard, be disciplined in life so that we can excel and reach any height. There are a number of examples for that. So my advice to all of you is that please focus your attention on hard work. Dedicate yourself and then make others happy. My dear youngsters, congratulations to you once again. And I also would like to compliment the management and also the staff, the faculty, and all the people who are all working in this institution. God bless you all. Thank you very much. Namaskar. Jai Hind.